Anal fistula is a condition that involves a tunnel or a communication between the outer aspect of the skin around the anus to the inside of the anus. Although medication can be used to try to minimize the amount of discomfort and pain, the only way to get rid of a fistula is through an anal operation. My name is Maher Abbas. I'm the doctor of the Digestive Disease Institute at the Cleveland Clinic, Abu Dhabi. Anal fistula surgery is some of the most common operation we perform in the anal part of the body. Typically, what we try to achieve is to get rid of the fistula, but at the same time to minimize any complication that can arise after the operation, and we try our best to preserve the patient continence. Because of that, there are several different types of operation. The first option typically is either seton or a fistulotomy if it's a superficial fistula. Most anal operations are typically brief. They can take anywhere from 15 minutes to an hour and a half of surgery time. Many of the patients can be treated on an outpatient basis where the operation is performed under an anesthetic and they can go home the same day. For a majority of anal fistula we treat, the patient typically is positioned in the prone jackknife position. That is a position where the patient is laying with the abdomen against the table. The operation starts by visually inspecting the area of the fistula and then performing anoscopy to look inside the anal canal. We use a metal probe to track the fistula from the outside to the inside to determine the exact course of the fistula. A fistulotomy is laying open the fistula with the intent of completely getting rid of the fistula. Once the two openings are identified, then we go ahead and divide the fistula using an energy source called electrocautery. That often involves dividing skin and fat. We clean up that tissue, and then we either leave the wound completely open to drain, or in select cases, we bridge back some of the muscle that had been divided. One of the most common anal fistula operation is the placement of a seton. And the main purpose of the draining seton is to allow for the fistula to drain properly so that the patient does not gather infection internally. Once we have identified the internal opening, we pass a thread through the fistula and we tie it on the outside loosely to allow for drainage. That procedure in most cases does not involve any cutting. The thread typically would remain in place for about 2 to 3 months to ensure stability and proper drainage. The last procedure that we commonly perform is an endorectal flap. We start the operation by removing the existing seton that had been placed 2 or 3 months prior to the operation, and we completely clean the tract by removing any debris from the tract. Then going inside the anus, we inject an anesthetic before we raise a flap that has the shape of a tongue, and we slide it down to cover the internal opening. For most patients, after the operation, they recover in a recovery unit for 1 or 2 hours before they go home. And typically, we advise most patients, depending on the severity of the fistula, to take 1 or 2 weeks off work. The actual healing of the fistula can take up to 3 months. The most important thing is to avoid constipation and to maintain proper anal hygiene after the surgery so the area remains clean. In general, most patients require 2 or 3 additional office visits to assess for healing of the fistula. Typically, the complication can be treated successfully either with medical therapy or additional surgery, but rarely a patient may end up with a long-term problem. The recurrence rate at the same site is typically uncommon. Symptoms in the anal area can be very uncomfortable for the patient to sit, to sleep, to stand, or to walk. And once they get rid of the symptoms, specifically pain, they're very, very grateful because they can resume all their activities.